Hi, I'm Morse, the founder of Core Elements Training, and this is Campbell, one of the tutors on our manual therapy course. In this short video, we're going to demonstrate some mobilisation techniques for the cervical spine.
I'm going to demonstrate PACVPs and PAUVPs to the cervical spine. The PAUVPs stand for passive, accessory, unilateral vertebral pressures, and the PACVPs stand for passive, accessory, central vertebral pressures. With the PACVP, the central vertebral pressure, we're going to be palpating and applying force to the spinous processes. For the PAUVPs, the unilateral, we're going to be applying the force or the pressure to the transverse processes. When we apply the pressure or the force, we're going to be positioning it towards the client's eyes, as this allows for the natural curvature of the cervical spine. So PACVPs, we're going to be applying pressure to the spinous process here using the bottoms of our thumbs. Find the spinous process and apply the pressure, performing the assessment movement first. Does that feel okay? Mm-hmm. So here you'll be able to tell the depth that you can go without you increasing any symptoms. The grade 1, 2, 3 and 4 rules still apply. Grade 1 and grade 2 to reduce pain. Grade 3 and 4 to increase range of movement. Grade 1, small amplitude. Grade 2, larger amplitude, not near the end of range. Grade 3, near the end of range, but coming back away from it. And grade 4 is a small amplitude within the end of range. So things to consider here is your posture. So try and keep your chest up so your back's nice and straight. If you can lower your couch, mobilisations usually are better performed on a lower couch. And usually 3 times 60 is the standard to start. You may feel a change before, and you can within one treatment move between grade 1, grade 2, grade 3 and 4. You don't just need to treat in one grade for that treatment. So these are both accessory movements, PACVPs and PAUVPs, and they work well alongside physiological movements such as rotation and lateral flexion, which we've shown in our other videos. For the PAUVPs, the unilateral, we're going to find the transverse processes, and you can find them just either side of the spinous process. These are more difficult to find in the spinous because you have got ligaments and other soft tissue and muscle running alongside. So again, using the bottoms of your thumbs, find the spinous process, then move along laterally, either to the left or to the right, and see if you can find the transverse process. And here again, you're just going to push it towards the eyes, your assessment movement first. And then perform whichever grade of mobilisation you like. If you have very hyperextended thumbs and you find it very difficult to create that nice straight thumb, you can reinforce your thumb, which is recommended because we're going to be here for 3 minutes and even longer depending on how many vertebrae you're treating. It's recommended to reinforce your thumb, which might look something like this. So one thumb on top of the spinous process and then another thumb on top of it. As long as you're not sliding on and off the spinous process and you're keeping the support on the spinous process with your thumb. So the pressure remains the same. The oscillations stay even and you're moving towards the eyes. So that was PACVPs and PAUVPs to the cervical spine using a reinforced thumb or having your thumbs together, palpating the spinous process and the transverse process. 2 accessory movements that can be used alongside physiological movements to increase range of movement and decrease pain around the cervical spine. So these are all techniques covered in our manual therapy short course, and if you'd like to find out more, please visit www.coreelements.uk.com. Don't forget to subscribe. Thank you very much.